Hello everyone, I am Dr. Nitin Krishnan PS. I have graduated from Government Tirunelveli Medical College. I have secured an All India rank of 104 in UPSC's Combined Medical Service Examination, All India rank of 1554 in INICET examination, and 3834 in the NEET PG examination. So this is a video where I would like to tell how you can use Marrow at its best for the NEET PG and INICET exam preparation. This is completely based on my experience right from my final year. So you may or may not agree with me at many instances in this video, but it is just a humble experience of mine. Hope this will help you in guiding your preparation ahead. So first of all, I would like to discuss things in two parts. First, if you are an intern. Second, you may be a repeater or an MBBS student who is studying in the third or fourth year. So based on that, the preparation strategy definitely changes, because when you are an intern, you have very less time. There is less daily study hours. So of course, you need a different strategy. That's not the case for a repeater or a third year or fourth year an MBBS student, where you can have ample time. You can go in detail or in-depth studying of all the concepts. So that will take your preparation, in a different way. So first of all, you are an intern. Okay, you are doing internship in a college. So you know that most of the colleges, I studied from South India, a medical college in South India. So internship is very hectic. So daily I could find only 3 to 4 hours of studies daily. So we have to initiate a plan that will take our preparation in a different manner. So first, what I would suggest is you have to switch the intern mode first, because in Marrow videos, if you are a Plan C user, definitely there is a mode called as intern mode, where only the most important, the so-called as the previous year topics, must-read topics, videos will be selectively, visible, and that will help you to read those topics first, and then you can go for the rest of the topics. And there is always, a confusion among the students who are using Marrow for their preparation. That is whether to study medicine from Marrow or not. I have been studying medicine from Rakesh sir's videos only, right from my final year. And to be very honest, of course, sir's lectures are lengthier. It looks very complicated. You need very good foundation to understand the concepts that is using to describe the various topics. But I'm just honestly telling, studying medicine is not just for cracking our competitive examination. I hope you all know that. But still, when it comes to competitive examination, the rule is to study smarter. Fine. So in that case, there is no need that you have to watch all the 200 or 250 videos in medicine. You can use Med 80 for medicine. Okay, that is medicine in 80 hours. And the PDF of the notes are also available if you are a Plan C user, and you will get the PDF in your email ID, and you can download that for future reference. And then coming into what subjects you have to do in detail, because even though you are an intern, it's not like you should only study the previous year topics, because on NEET PG 2024 and NEET PG 2025, the areas, the topics that the examiners have started asking, it's not just only the repeated or the previous year topics. They have entered the newer topics, newer areas as well. So it is mandatory to read the following subjects in detail if you are aiming for NEET PG. First of all, that is surgery, obs and gynae, community medicine, and of course medicine. I told you medicine, you can go for Med 80, because these subjects, the weightage of questions is very high. For example, medicine, surgery, OBGY, nearly 20 to 22 questions every year they are asking. So you can't just rely only on the previous year topics. So that is why I itself emphasize on reading these subjects in detail. If you are an intern, also you have to do these subjects in detail. For example, community medicine and all, it's a completely factual subject. Okay, except the biostatistics parts, which is a bit conceptual. Rest everything you have to just remember facts by heart it. In that case, it is advised to do community medicine, obs and gynae, surgery and medicine in detail, so that whatever be the areas the examiner is trying to evaluate, you will be able to at least make a smart guess, because community medicine is a subject which is like mostly factual. So if you don't know the answer, there is no point in making a guess. So I highly recommend you to do these subjects in detail. Subjects in detail in the sense you have to watch the main videos. Make sure that you are covering every topic, okay, from these subjects. And of course, like other subjects, previous year topics, you should just master it, okay. And if you are aiming for INICET, INICET is an exam which always tests your first and second year subjects compared to the third and final year subjects. Because even though the questions from the final year subjects look so complicated, most of the questions you will be able to answer it, but your knowledge on pathology, pharmacology, anatomy, biochemistry, physiology, all these subjects actually determines your rank. Okay, whether you have to be in the top 1000 or not, that is completely determined by your performance in these subjects. And if you just read the previous year topics, I don't think that it will be enough for you to ace your INICET preparation, especially May INICET, which is very competitive. And in the May INICET 2024, once you see the previous year questions of May INICET 2024, you will understand how in-depth anatomy and physiology concepts are being tested in an exam like INICET. That's not the case with the NEET PG. Anatomy, physio, biochemistry, and if you read superficially, or if you are just if you have just mastered the previous year topics, most of the questions you will be able to answer. But that's not the case with the INICET exam. Every time they will ask newer concepts. Okay, in-depth knowledge of these subjects is needed. So if you are a person who is targeting for INICET, please make sure that you are doing main videos in detail of first and second year subjects. Okay, yes. And whether you are an intern, whether you are a repeater, whatever the case, last 3 months you have to use the revision videos or the revision notes PDF, which you will be getting in an email. If you are a Plan C user, you can use that for a quick revision, because reading main notes subject by subject for all the 19 subjects, it will take, of course, a long time. So I strongly recommend you to revise using your revision notes. And I also personally have used revision notes for revision during the last 2 to 3 months of preparation. Okay, yes. So you can either go for the video mode, or you can either refer the notes. Or suppose you are of a person like, sir, no, I don't have time to read everything, all the subjects from the main notes. As I told you, just do the mentioned subjects main videos and rest all the subjects, for example, pathology, pharmacology and all. Especially if you are aiming for NEET PG, you can just rely on the revision notes. Most of the questions are covered in the latest edition of Marrow's revision notes, and with that itself, you can answer most of the previous year questions. But if you are aiming for INICET, I strongly recommend you to do the first and second year subjects in detail from the main notes itself, because the revision notes won't be enough for the first and second year subjects if you are a student who is preparing for INICET exam, especially May INICET, which is very, very competitive, and May INICET always tests the first and second year subject knowledge in depth. Okay. Whether you are an intern or a repeater, I would like to give you a timeline that you have to keep in mind. First reading with question solving. You can take around 6 to 7 months. First read in the sense you are watching the main videos, you are referring the main notes, and you are a person like you feel like you have to strengthen chapter by chapter question bank. Okay, you have to cover chapter by chapter. I strongly recommend you take 6 to 7 months. First, go for the major subjects. The major subjects means if you are a NEET PG aspirant, definitely it is the final year subjects. Okay, there is medicine, surgery, obs and gynae, and pediatrics. Then you can go for the community medicine. Then you can come to the short subjects. Then you can go for ophthalmology and ENT, and finally the first and second year subjects. So you are taking 6 to 7 months to cover all these 19 subjects with main videos or main notes with side-by-side question solving. And next 2 to 2.5 months you can use for the second read with the custom modules, because in the first read you will be solving chapter by chapter questions. So in the second read, that is, you are revising your main notes. Okay, you are doing a repetition of the main notes, and side by side you can go for a custom module revision. That means daily you are advised to solve minimum 50 to 100 questions on all the 19 subjects. Okay, all 19 subjects. And irrespective of your level of preparation, I strongly suggest you to solve 50 questions all subjects custom module daily, because that will help you to keep in touch with all the subjects. Okay, all the subjects daily. That is very, very important, because our preparation phase is for around 1 year, so it will take lot of time to cover all the subjects, and by the time you cover the first and second year subjects, you will forget the third and final year subjects. So I strongly recommend you to do custom module revision and daily 50 questions, 50 to 100 questions minimum of all 19 subjects custom module, so that you always keep in touch with all the subjects. So second read you can go for like that. And the third read, yeah, that means, for example, if the NEET PG exam or the May INICET exam, okay, the duration will be in the timeline will be in the month of May or June, and in that time, before that is exactly 1 to 2 months before, it is advised to solve PYQs and PYTs. Okay, read previous year topics again and do PYQs. There is no point in doing PYQs and PYTs in the first initial 4 to 5 months, because you lost in touch with those topics. So I strongly recommend go for the main videos and main notes from the first itself, and then the PYQs and PYTs you can do later, so that the time before the exam you will be confident, you will be damn thorough on the previous year topics. Okay, you will be mastering the previous year topics, and at the same time you can take the PYQ side by side. Fine. And the third read, this PYQ 1 to 2 months time you can do along with the MCQ discussion videos which are present in the Marrow, because all these MCQ discussion videos, the questions are framed by the faculties themselves, and that will definitely give an extra edge. Okay, in the last 1 to 2 months, if you are doing this combined revision of PYQ, PYT with MCQ discussion video, you yourself gains confidence in all the subjects individually. And the final revision, the last 1 month, just revision notes or with the revision videos. We are going to just revise what is important, the salient points in every topics in all the subjects. So this is actually the timeline I would like to suggest. Then, how to practice questions. If you are an intern, as I told you, daily 50 question, all subject custom modules, okay? Plus whatever chapter you are studying. For example, you will be studying medicine, cardiovascular system. Make sure that you are solving at least 50 to 100 question custom modules of the particular topic daily. And make sure you are practicing enough questions in the previous year topics. That means, for example, I am telling a previous year topics in medicine, that is decompensated liver disease, liver cirrhosis. Another topic, ECG. You know, whether it is INICET or NEET PG, one ECG question they will be asking very frequently, repeated question. So make sure that you are practicing more than enough question on the previous year topic called ECG, so that whatever be the level of question, whether it is a silly question, whether it is a tough question, whether it is a high standard question, you should be able to answer. So Rakesh sir always used to say in his videos, how you have to study the previous year topics. You have to study the previous year topics in such a way that whatever be the level of question, you should be able to answer it. Whether it is a silly question, whether it is a tough question, okay, whatever be the level of question, you should be able to answer it. So this is actually the way in which you have to master the previous year topics. Please don't study only the previous year questions. Previous year questions are not repeated actually. It is the topic which is getting repeated. So if you feel that ECG is the very high yield topic, make sure that you know how to read an ECG, how to interpret an ECG, what is the drug of choice, what is the management, the guidelines, everything. So this is actually you have to master previous year topics. So make sure you're practicing enough questions in the previous year topics from the chapter wise question bank modules. And in the last 3 months, practice PYQ of both AIMS and NEET. You will be thinking like, sir, I am a NEET PG aspirant. Do I need to solve the INICET question? Of course, yes. In the last few years in NEET PG, once you see, you can understand that many questions are INICET previous year topics. Yeah, it's not the question, it is a topic. So make sure that you are solving both AIMS and NEET irrespective of the type of an aspirant. Then, test actually decides everything. Okay, because you yourself have to train yourself in an environment that is a time bound environment, okay, that is which happens only in test. For example, in many tests, 20 questions in 19 minutes or 50 questions in 53 minutes, subject wise test. So make sure that you are giving that test, that this test is completely different from custom modules. Okay, because the questions are completely different in Marrow. Okay, you can solve at least last 3 years of subject wise test. Okay, that itself will take give an exposure to many topics at once. For example, you are doing OBGY subject wise test. 1 year there are 2 OBGY tests. So if you do 3 years, 6 tests, and that 6 tests 6 into 50. Okay, that much amount of question, number of questions you will be covering per subject. And while doing subject test or mini test, in recent years, what we understand from Marrow's mini test is that all are integrated pharmacology, integrated pathology, then anemia, fever. All these topics looks isolated, they look so weird, but on solving those questions, which are completely new, okay, which are completely different from the regular custom question bank modules, you will understand that you will develop a skill of making a guess. You will develop a skill of approaching new topics, okay, how to make a smart guess, many things. So please, I advise you to give tests regularly, mini test and subject wise test, and while doing that you will automatically identify which subject is weak, which subject you have to once again read it thoroughly. For example, and for me, obs and gynae is a very weak subject, so I always used to give many subject wise tests frequently in obs and gynae, and slowly I developed confidence in OB/GY subject. So all these resources are available in Marrow, so I'm just guiding you how you can use that during the proper time in your preparation. Then to start giving GT as an intern. Yeah, this is a very, very common question that every aspirant will be having. When I should start giving grant test? Actually, there is no minimum cutoff number of subjects for which after which you have to start giving GT. If you finish just one subject, still you can give GT, but it all completely depends upon your mindset. If you are a person like, no sir, if I get very less score, I will get depressed and that will affect my preparation, then you have patience. Once you finish the major subjects, that is the final year subjects and all, you can start giving GT. Okay, 5 to 6 major subjects, medicine, surgery, OG, PSM, then path, farm, because all these subjects have maximum weightage in a particular grant test. And once you do that, okay, once you finish those subjects, you can go start giving grant test. Please make sure that you are reviewing grant test properly. For example, after some 3 to 5 months of reading, from the 6th month onwards, you are start giving grant test. Today you are giving the first grant test. After 10 days or 15 days, you are going to give the next grant test. In that 15 days time, what you are going to do is, you yourself know that you just finished 6 subjects. In that 6 subject, imagine out of 200 questions, from that 6 subject, they have asked around 100 questions. You are going to analyze that 100 questions first. Out of that 100 questions, how many you get right, how many you get wrong? Because you know that you studied only 6 subjects. There is no point in judging your performance based on your scores in other subjects that you haven't even read. For example, you haven't even studied anatomy, and out of 10 questions, sometimes out of guess you may get 5 correct, and out of guess you may get 5 questions wrong. There is no point in judging that, coming into a conclusion that, okay, I am weak in anatomy or I am good in anatomy. No, because you haven't even studied anatomy, no. But that's not the case with the other 100 questions, because already the 5 to 6 major subjects you have covered. So make sure that you are evaluating, you are judging your preparation based on your scores on that subjects alone. Because many students, they feel really bad after their GT score. Sir, I studied 6 subjects, but still I get only 100 correct. See, from that 6 subjects, they have asked 100 questions. In that 100 questions, you are getting 80, 90 correct. That is really a good score. Try to appreciate yourself for your small achievements. Okay? Because during this is a 1 year of preparation, and nobody will come and appreciate you for small achievements. So you yourself have to appreciate yourself. Small achievements, small scores. For example, out of 50 questions custom mode, if you are getting 35 correct, yes, try to appreciate yourself. Find out the mistake, rectify it before the next day. You always have to compare yourself. Okay, you always have to compare what you are today with what you are yesterday. Please don't compare your journey with anybody else. Please don't do this mistake. Okay, just because another aspirant in first attempt he got this much rank by studying only PYQ, that doesn't mean that the same strategy should work for you. You plan your strategy, do additions and subtractions. Okay, whichever subjects which are strong for so much confident for you, that's not the case for another aspirant. So everybody's journey is different. So please don't compare your journey with others. Just compare what you are today with what you are yesterday. Yesterday I got, out of 50 questions, I got 35 correct. Today I should get 36 correct. That should be your aim, because that only will push you forward in this preparation phase. So before giving another GT, make sure that you are reading enough, solving enough questions in the weak areas. Out of 6 major subjects, after giving GT, you found that the base 4 subjects, weak 4 subjects, you are going to identify it. For example, medicine CVS, 6 questions. In that 4 questions I got wrong. That means you have to do CVS the chapter again. You have to solve more questions. You have to see the PYQs and PYTs, because grant tests are not PYQs or PYT based. Okay, grant test covers every areas in every subjects. Every grant test is different. So at the end of a grant test, before giving another grant test, make sure that you are putting ample efforts to strengthen that subjects. If you are good at concepts, if you have covered almost all the major areas in a subject, no doubt you can get into a score of 135 to 145 questions correct in GT after your, during the after some 5 to 6 months of your preparation. Definitely you can get into that score. Okay, once you do the major subjects, major topics, you can automatically get this score. If you are not able to get 135, 145 means you are very weak in your notes. Because that 130, 140 mark you will be able to achieve only if you master the notes. So come back to the notes, try to make it clear at your level best. Giving GT is very important the last 5 months of preparation. Why? Because it's a time-bound exam. What you think about GT is it is going to just assess your knowledge. No, 200 questions. First question will be from anatomy, second question will be from medicine, third question will be from surgery, fourth question will be a radiology question, fifth question will be an orthopedics question. So in each minute you are encountering different questions from different subject, different topic. All are time-bound exams. Okay, we have 5 sections in NEET PG and 4 sections in INICET. Within that 40 minutes, how I am solving 50 questions. Within that 52 minutes, how I am solving 50 questions. So that time decides everything. If you spend more than 2 minutes in a question, maybe at the last, very simple questions you may miss it. So it not just assess your content or knowledge in a subject, it will help you for active recall, your recall ability, your concentration, attention, the way you read a question, because you will miss all are true except, all are false except, false statement, true statement, yes, not true regarding the management, all these words you will miss. So in order to train yourself for all these things, you have to give test, mini test, subject test, grant test. Okay, only while doing test, you will be able to find which areas you are weak in, which areas you are good at, whether you have proper time management, everything. So please give GT in the last 5 months of preparation. That really takes you to a great rank. Then, suppose if you are a repeater or an MBBS student, watch main videos of all subject, daily practice chapter-wise modules of all major subjects, and then you go for the others, because if you are a repeater, the timeline remains the same as I have mentioned in the first part of the video. And daily 50 question all subject question modules, that is again important, because then only you can keep in touch with all the subjects. Start giving GT from beginning once you finish your final year subjects and review properly. Subject test and mini test can be used to strengthen your individual subject and topic. See, all this remains the same. The one thing key important difference between an intern and a repeater is a repeater will have more time. For example, most of the day you will be at home. So an intern will be able to study only 3 to 4 hours a day. He can study up to 12 to 16 hours a day. So you can do main videos in detail. You can read main notes in detail of all the 19 subjects. That's not the case for an intern. The intern can only do the major subjects, main notes and videos, and rest of the things you have to see the revision videos, you have to go for a retrospective manner. That is, while solving questions, previous year questions, you have to study the previous year topics, then you have to strengthen the individual previous year topic. So it's a retrospective manner. There is a prospective manner is study what pattern is actually followed by a repeater student, because you have more time. Fine. So with this, I hope you will get a complete idea about how to use Marrow, because Marrow has everything. It has revision videos, it has revision notes, MCQ discussion videos, mini test, subject test, grant test, then everything that will help you to prepare for all exams. That is combined medical service exam, INICET or NEET PG. I personally have used only Marrow for all these exams. So based on that experience, I just delivered my humble advices for all the future NEET PG and INICET aspirants. The 2 important things that you have to keep in mind: give more tests. Stay in touch with all the 19 subjects, whether you are an intern or a repeater. The second thing, revision is the key. Make sure that before you go for the final exam, whether it is INICET or NEET PG, make sure that you do at least 3 to 4 rounds of revision. Rounds of revision in the sense, at least 3 to 4 times you have to do all the 19 subjects again, either with your main notes or with the revision notes or with the MCQ discussion videos or with the revision videos, whatever it may be. make sure that in the last 3 months you are mastering the previous year questions and topics once again. You are solving ample PYQs, both INICET, AIMS, as well as the NEET PG pattern, so that when you are going to approach the exams, whatever be the difficulty level of the exams, you will be able to get a good rank. Hope these videos help you all. And for a repeater, as I am once again telling, you have more time. You can do every subject in detail, but try to follow the same timeline, because you will think that a repeater will have, okay, you have 1 year. No, the time will fly like anything. So try to finish all the subjects first read within the first 6 to 7 months, then go for another 2-3 rounds of revision later, and the last 1 month just revise what is needed. Okay, not everything. That is, with the help of revision videos or notes, you can do a perfect revision. And hope this video help you all in preparing for a NEET PG or an INICET exam. INICET first and second year subjects decide your rank. Okay, whether you have to be the top or not, that is completely decided by your performance on the first and second year subjects. That's why I'm telling that again and again. And I hope this video help all the future NEET PG, INICET and UPSC CMS aspirants, and all your queries can be posted under this video. I will be answering it. Thank you.